Many people say that I am so brave, but one of my greatest fears was how the medical community would receive me. A medical community whose support I so desperately needed to finally become my true and authentic self. I was fortunate in my transition journey from male to female to receive very positive treatment from healthcare providers. In 2006, I had 11 hours of facial feminization surgery. 6 months later, I had breast augmentation surgery, and a year later, I had gender reassignment surgery. Hi, I'm Gina Duncan, Director of Statewide Transgender Inclusion for Equality Florida, and it means a lot to me that Orlando Health is committed to improving the health and quality of life of the individuals and communities that they serve. But before we go over terminology, statistics, and healthcare challenges, it's imperative that we understand the differences between gender identity and sexual orientation. Gender identity is your innermost concept of self as either male, female, a blend of both, or neither. It's how individuals perceive themselves and what they call themselves. And it's important to note that a person's gender identity can be the same or different from the sex or gender assigned at birth. When we talk about sexual orientation, we are referring to your emotional, romantic, and sexual attraction to individuals of a particular sex or gender, male or female. So now that we have that squared away, let's break down the acronym LGBT. That is used for a community of people whose sexual orientation or gender identities can create shared political and social values that stem from wanting to live an authentic life. This is what each letter stands for and its meaning. The L is for lesbian, which is a homosexual woman. G is for gay. This is a person who is sexually attracted to people of their own sex and a synonym of being homosexual. B stands for bisexual, which is a person who is sexually attracted to both men and women. And T is for transgender, which is a person who feels that the male or female anatomy they were born with does not match with their gender identity or innermost sense of self in terms of their gender. So, LGBT is an umbrella term used to describe the community as a whole, with lesbian, gay, and bisexual addressing sexual orientation and transgender addressing gender identity. You may be wondering how many people in the U.S. are part of the LGBT community. The most recent data tells us that 3.8% of the U.S. population of over 324 million identifies as LGBT. This is a total 12,326,789 adults, of which 48% are anatomically male and 52% are female. 29% have children, 61% are Anglo or Caucasian, 15% are Hispanic, 11% are African American, and 10% are from other ethnic backgrounds. Now let's bring it home. Florida's population is 20,636,975, of which 4.1% identifies as LGBT. This is a total 846,116 adults, of which 48% are anatomically male, 52% are female, 26% have children, 59% are Anglo or Caucasian, 18% are Hispanic, 14% are African American, and 9% are from other ethnic backgrounds. And when we look at the most recent Orlando, Kissimmee, Sanford data, our total population is 2,326,729 citizens, of which 4.1% identifies as LGBT, representing a total of 95,396 adults in our region. I am often asked, what does it mean to be transgender? As I mentioned before, transgender is an umbrella term used to describe a rapidly emerging community within our society whose gender identity, one's inner sense of being male or female, differs from their assigned sex at birth. An estimated 1.4 million adults in the U.S. identify as transgender. and Florida now ranks as the 6th largest transgender community in the U.S., represented by over 100,000 adults. LGBT patients generally are admitted to hospitals for the same types of care as other patients, although transgender patients may also enter hospitals for transition-related health care services. To transition means to undergo a process by which a person changes their physical gender characteristics to match their inner sense of being male or female. This process may include a name change, a change in preferred pronouns, and a change in social gender expression through things such as hair, clothing, and restroom use. It may or may not include hormones and surgery. When a transgender person makes that very personal decision to transition, which means putting everything that they hold dear in their lives at risk, having the support of their healthcare providers is so important. I remember checking in with the front desk nurse to have my facial feminization surgery, and she corrected me when she asked my name. She said, "No, I need your female name." That small interaction was so validating. I remember after surgery coming out of anesthesia and hearing the staff referring to me in female pronouns. Even in my half-conscious state, I was thrilled. Even though I was just beginning my transition and was presenting in a somewhat gender-neutral way, I shared a hospital room with another woman. I was directed to use the female bathroom if I was walking the hallway, and I was addressed by all staff members and doctors in accordance with my gender identity. All of these factors made me feel comfortable and well cared for. I felt confident that the staff understood what it meant to be transgender and how important pronouns were. From the initial step of hormone replacement therapy to my final step of having gender reassignment surgery, my interaction with healthcare providers would be extensive. Looking back, I was so fortunate in that my job afforded me the ability to engage quality healthcare resources that enabled my gender transition to be a very positive experience. Let's pause and think about the tremendous impact your work in the healthcare industry has in the lives of people who identify as transgender. Transgender people have become widely recognized as a community that faces significant barriers to equal, consistent, and high-quality healthcare. From instances of humiliation to outright refusals to provide care, many institutions, consciously or not, have made it very difficult for transgender people to receive respectful health care. A 2011 survey of over 6,000 transgender Americans revealed that 19% of the respondents reported being refused health care due to their transgender or gender nonconforming status. 28% postponed needed health care due to harassment or discrimination concerns. 33% delayed needed health care due to cost or lack of adequate insurance. 75% expressed concerns about restroom usage. 27% reported being denied health care due to their transgender status. Transgender people often simply do without health care, and treatable medical conditions too often become emergency medical problems. This is actually a common situation in other communities with reduced access to care. Why is it important that healthcare providers support an environment of diversity and inclusion? Hospitals have embraced LGBT equality and inclusion in their policies and practices for a variety of compelling reasons. First, equitable and inclusive policies and practices ensure compliance with the Affordable Care Act, and in some areas, state and local law. Section 1557 of the Affordable Care Act specifically prohibits discrimination on the grounds of race, color, national origin, sex, age, or disability in certain health programs and activities. The Joint Commission's patient-centered communication standards include revised elements of performance that prohibit discrimination based on sexual orientation, gender identity, and gender expression, and that ensure access to a support person of the patient's choice, which are critical issues to the LGBT community. Through compliance, Hospitals reduce the risk of complaints and litigation and maximize patient satisfaction, safety, and quality of care. These policies and practices also provide much-needed guidance to hospital staff who interact daily with LGBT patients. In addition, transgender, lesbian, gay, and bisexual patients are highly loyal to hospitals that offer them respectful medical care. Some healthcare facilities have added to their growing customer base by reaching out to the LGBT community. Adopting transgender inclusive healthcare practices can also reduce the costs associated with complications that arise when transgender patients are denied or delayed medical treatment due to discrimination. Finally, hospitals that ensure equity and inclusion for transgender patients signal a powerful overall commitment to diversity and demonstrate that they are at the forefront of best healthcare policies and practices both in the community they serve and nationwide. So the end goals are to provide a safe and welcoming healthcare environment for LGBT patients, ensuring that hospital team members are courteous and respectful of gender identity, respecting patients' rights to privacy and confidentiality during medical treatment, and to provide equal access to quality medical care to the LGBT community. As an Orlando Health Team member, every day represents an opportunity to care for your patients, to nurture them and restore them when they need you the most. I encourage you to continue to build Orlando Health's reputation as a hospital network where compassion, understanding, exceptional care, and inclusion are paramount.